You all can see the slide?
Yes.
Okay, great.
Yes, yes.
Great. So the topic for today evening, which we're just starting with, is the role of diet.
Mehar, just a brief,
Yes.
before you begin, let me introduce you. Small words of introduction for a big colleague of our hypertension core group. Thank you for joining in, Mehar. It was so kind of you to take on this topic. Mehar is a clinical dietitian. She is practicing in Bombay, and she has been in similar hospitals where we have done our internship. So I was just reading, it was Tata's, and it has been, you've done it in Tata's and
KEM,
what do you, KEM hospitals?
LPNG, yeah,
You've been
LPNG also.
KEM and Tata's, yeah. So likewise, I mean, so it was very nice to have that connect, and it feels nostalgic the minute you say it's somebody's from Bombay. So thank you for having taken the invitation, and a very important topic that we would learn more from you. So Mehar, please go ahead. Thank you.
Thank you, IAPN, and it's really nice to be together and update and look into review, research, and grow together. And it's so nice to have Safal ma'am with us over here from KEM. Okay, so to begin with, role of diet and gut microbiome in hypertension is what I'm talking about. Now, as we all know, all the disease begin in the gut is what Hippocrates said, and that was 2,500 years back. So basically, it's the quality and quantity of food which we eat, which is directly affecting our gut microbiome, and our immunity is definitely a mirror image which has been manifested. Now, trials, cohort studies have definitely confirmed this. And our gut is basically made up of 100 trillion microbial cells. So you all can see the image over here. It's been estimated that the human gut houses 100 trillion microbial cells. And it's such a big amount, and it's also 10 times the number of human cells. So definitely gut immunity is something we all have to look into, and it has its effects on inflammation and disease. Yeah, so we move on to the next slide. The role of diet and gut microbiome in hypertension. As we all know, excessive salt intake can definitely give us a rise in the blood pressure. So what we are looking at is, one second. What we are looking at is intake of sodium, which is less than 2,300 mg per day, so that we don't fall into this category. Because once we come into the hypertension category, again, we are at major risk for CVD disease. So now the big question which lies ahead of us is, can we rebuild the gut microbiome? Yes, the answer is yes. So how does this happen? Like, I have cases coming to the clinic and most of them lack fiber. So, cases like hypertensives or cancer patients for that matter, or even dyslipidemias, high cholesterol, hypertension, we're just telling them forever, please eat more fiber, please incorporate salads, soups, detox, your blood. This is what we're telling them. So primarily all these years we've been telling them it has a hypoglycemic effect, it has a hypercholesterolemic effect. So what exactly is happening over here is that the fiber over here works as the prebiotic. So once these prebiotics are taken along with probiotics, they definitely speeden up our gut biome restoration. So interventional studies show that the addition of fruits and vegetables, salads to meals showed an increased formation of short-chain fatty acids by the gut microbiota, which in turn are taken up by the receptors in the kidney, and they work towards lowering blood pressure via the renin-angiotensin mechanism. We all know that the blood pressure is controlled by the kidneys. So definitely the effect of, the benefit of rather having more fiber is certainly seen over here. And people who have more carbs or fatty meals and meals which are having a lot of inflammatory foods definitely have less formation of short fatty chain acids, which in turn would not help the decrease in blood pressure. So the blood lowering effect is not there in those diets which lack the fiber. Hence, we are definitely promoting prebiotics for gut immunity. The next slide takes us to a study which was based on the previous findings. Now, as we all know, excessive salt also alters the gut microbiome, which in turn leads to hypertension. So there was a study conducted wherein they had two groups of mice taken up, and this was the group in which there was salt sensitive mice which had blood pressure, and a group in which they were resistant to the salt given to them. So what exactly was done is these two groups were formed, and once these groups were formed, the microbiome, the very gut microbiome from the salt sensitive mice whose blood pressure was high was transmuted to the ones which were salt resistant mice. And what exactly was seen is that even these mice, once they were introduced with the gut microbiome from the salt sensitive mice, the microbiome of these mice also showed inflammation, and it also showed high blood pressure. So this makes it very intriguing for us to look into these aspects furthermore. And there has been a lot of clinical testing, trials, cohort studies, giving us more clarity thereby on how this whole thing is interconnected. So this is what was seen: higher blood pressure and again high inflammation and hypertension just by the introduction of that different kind of genome. What was found from all these studies was that Lactobacillus corniformis is one kind of a variant in the gut microflora, which has been shown to improve vascular functioning. And thus it helps ameliorate CVD disease and also promotes immunity. It's also beneficial for insulin sensitive cases. So it helps diabetes mellitus too. Studies have also shown that a rise of 4 to 5 mm of HD. Basically, this is, if the person has an erratic lifestyle, too much of stress, not exercising. So a rise of this 4 to 5 mm of HD, even out of this, if somebody starts, exercising or, stops smoking, follows a good eating pattern, meditates, and if they have a reduction of 2 mm of Hg, the decrease in the overall CVD mortality will be by 7%. So our prime target is what exactly? Avoidance of inflammation triggering high fatty, spicy, sweet, salty foods, canned processed foods, as we all know, artificially colored, preservative filled foods, so that one can work more efficiently. One should focus more rather on freshly cooked foods based more like the Mediterranean diet, and also coupled with the DASH diet to see further health benefits. And specifically in the cases of hypertension, which would head towards CVD, this is something very important. Do probiotics reduce blood pressure is again something which was worked upon. So a lot of studies were done, and they came to clarity that the effects of probiotic consumption on blood control is positive. So consuming probiotics could significantly reduce the systolic blood pressure by 3.56 mm of mercury and diastolic by 2.38 mm of mercury, which was again a positive indication. So in totality, the prebiotics and the probiotics both have a very, very good influence on the gut microflora, which enhance, anti-inflammatory lining of the colon, which would enhance gut immunity, which would take us away from the classic disease like CVD, DM, hypertension, cancer, irritable bowel syndrome, gut leakage, and so on. Now, this is what research has shown, that lactobacillus is one of the best probiotics, which which when supplemented was showing a reduction in the 24-hour ambulatory blood pressure. Lactobacillus bulgaris and Streptococcus thermophilus, again present in yogurt as probiotics when given, have shown very powerful anti-inflammatory and immunomodulatory effects. I'm just going to that slide. Yes. So basically, which are the foods which heal the gut microbiome? It's all kind of prebiotics, which I've mentioned earlier in the previous slides, and the probiotics like kefir, yogurt. It could be live active cultures of pickled vegetables, tempeh, kombucha, tea. That's kimchi. Again, we all know of sauerkraut, kimchi, miso, natto, all these kind of foods. I would say I have many patients coming and with irritable bowel syndrome. So the most basic thing which I land up telling them is, if you'll have freshly made curd at home, which is not sweet, like unsweetened, minimally unsweetened, आप ले लीजिए. उसमें आप अपना दही inoculate करके, जो fresh दही है, the room temperature yogurt is what I'm talking about, when had, will give you a lot of benefit. Even if there's boiled rice at home, you mix the rice and the curd and keep it for some 7 to 8 hours, let it ferment and have that. That will work as an excellent probiotic for the gut. So it's not necessary that we have to go for spending quite a bit on all these kind of things, or getting special yogurts which have been processed and canned specifically. Even basic simple home buttermilk, curd, rice give us a lot of good effects on our gut. Yeah, so let's look into some other nutrients besides the ones I've mentioned, which may help gut immunity and prevent leaky gut syndrome. Zinc, again, glutamine, L-glutamine, as we all know, collagen, fiber, dark green leafy vegetables, curcumin, that's turmeric, which is anti-inflammatory in nature, and berberine. Along with this, we do tell patients to have magnesium, have good amounts of vitamin A, D, E, K, vitamin D, because the overall peristalsis of the food coming down from the colon needs a lot of factors to be considered. And so proper water intake, walking, anti-stress life, all those things would play a very important role besides all this which I'm trying to tell you. So how can we clean the gut naturally? The first thing we tell the patients to come in the clinic, and when they give us their recall, is we tell them in the morning when you'll get up, put alkalizers in your system, alkalize the gut, because the whole night it's not had anything much, so it may be in an acid mode. So the first thing you do is have a lot of water, then start your day. Staying hydrated is something very, very important. We've had patients who had constipation and IBS. So a lot of water intake early in the morning, which is followed by fruit intake and walking, has been emphasized in such cases, which gave us very good positive results as far as their irritable bowel syndrome and constipation went. So definitely drinking lukewarm water has been shown to aid digestion. Also gut cleansers like fruits, vegetables which have more water content, watermelons, tomatoes, lettuce, celery, all these have beneficial effects on the gut. Fasting again. Now, I think now it's Navratra time. Everybody is also into fasting. So such breaks are very good for the system. Such breaks are very good for the gut. They definitely reduce, the constant stress on the gut, and they reset the microbiome by increasing the symbiotic, microorganism diversity. So definitely such things should be taken up. Even patients who are fasting for losing weight, they are definitely benefiting from this a big time. Does meditation affect digestion? Yes, we can't negate this. There's a lot of oxygen coming into the system, especially if you couple up pranayama and meditation. So, what is happening is that we are not only detoxing our chakras, we are also activating all the organs right from our head till our anal canal when we are meditating, and especially the breath work, which has been, shared by gurus, the big gurus of India. That is. If you know Sadhguru or even Sri Ravi Shankar, the breath work which they have shared with many throws a lot of oxygen into our system, which really helps the immunity build up. And today, clinical research has shown that there's an effect of all the breath work and the oxygen coming in on each and every cell which is related to our gut, and it definitely influences the gut microbiome. So I would suggest everybody to implement on yoga, work with breath work, pranayams to be taken up along with walking, which have shown a lot of benefits, especially in the cases which I have seen in the last 25 years of my practice. Yes, so the other advantage which meditation definitely has is that we all have stress, right, in our lifestyle. Is there any other way to combat stress? One good way is meditation. So it helps regulate the stress response, thereby suppressing chronic inflammatory states. I am promoting this and I'm repeating this again because I have been with breath work for a lot of years of my life, and I have given it to all the patients who come and sit in front of me. It not only helps them with their immunity, but they also come to a stage where they can say no to alcohol, no to smoking in such a beautiful, graceful way, without being forced. So I've seen miracles with this, and I would definitely suggest you all to share this message wide across. So last but not the least, a very, very good night's sleep, that's at least 7 to 9 hours, along with avoidance of alcohol, avoiding smoking, exercising regularly, timely, balanced, fresh meals. And as I mentioned, these two are two important pillars, especially, in today's lifestyle with all of us. All these would lead to a happy me. A happy me is what I want. So when I am happy, when my body is happy, it produces less toxins. It's just beautiful in its way. It's healthy, it's complete, with no emotional turmoils, a lot of spiritual uh, pillaring. The foundation over here today for us has to be a spiritual quotient, has to be strong, our emotional quotient has to be strong. So I'll definitely bolster and promote something like this, which also keeps our emotional quotient at its peak, keeps us happy all the time in spite of all the challenges that we all face, which takes us in leaps and bounds towards good health in multifactorial ways. So I would like to thank everybody here for listening to me patiently. And yes, I'd like to end my sharing. Any questions, if any? Any queries,
I
if
think
any?
I think there's one question from Shruti which
Yeah.
says, which is the best time to have probiotics
Yes.
and should it be avoided during dinner?
Yeah, so basically the best time to have probiotics is half an hour before your lunch hours. So we generally tell the patients to have a glass full of buttermilk, which is also a low cal filler, before they start with their main meals. And we tell them to start their main meals with platefuls of salad, focus on limited portions of carbs and proteins, and emphasis on lot of vegetable along with that, so that there's gut cleansing taking place. At the same time, it has a multifactorial benefit on their overall health. Now, capsules like Neutrolin B are recommended generally in the morning hours. That is, prior to half an hour prior to breakfast, if at all they may need to do so. And even if somebody has gone through a bout of infection and has been on antibiotics for 5 to 7 days, we suggest them to have econom, which again takes care of the homeostasis of the flora after the infection, to have the good microflora setting in beautifully. So these are the basics we follow for the cases who may need it.
Thank you, Meher. I think that was a very clear, concise, lucid presentation. Very clear indications of what is to be done for gut microbiota, especially because there's so much of research and there's so much of ideas floating around. So I think this gives a very, very clear perspective to what we can advise.